Hello, everybody. Let me just double check. Have a little bit of okay. Okay, well, good morning or afternoon, depending on where you are connecting from. My name is Maria Fernanda Espinosa, for those who don't know me. I'm currently the Executive Director of Global Women Leaders and lead of the Universal Health Coverage 2030 Political Advisory Panel. So welcome again. Thank you for joining this webinar. This webinar is hosted by the Coalition of Partnerships for UHC and Global Health. And as we are now only 10 days away from the UN high-level meetings on health in New York, it is more important than ever to keep the momentum high. So today's discussion will focus on the need for countries to prioritize equity, make actionable commitments, and ensure coherence across all political declarations to be adopted in New York next week. The pandemics high-level meeting, the TB high-level meeting, and the UHC high-level meeting. So before we get started, I would like to remind everyone that you can ask questions using the Q&A box anytime during this webinar. We will respond to as many questions as possible. And we will start with opening remarks by our UHC 2030 co-chair, Gabriela Cuevas Barrón. Then we have a stellar panel today, 3 representatives of the coalition, Ms. Kathy Dane, CEO of the NCD Alliance, Ms. Angelia Krekar, Deputy Executive Director for Programs of UNAIDS, Dr. Subhanan Shahu, Deputy Executive Director of the Stop TB Partnership. They will share their views basically around 3 questions. They will do so in 5 to 7 minutes. Basically, they will reflect on 3 key issues as mentioned. First is how to guarantee inclusive decision-making processes, deliver ambitious actions at the country level, and how to keep health on the highest political agenda beyond the high-level meetings. After our 3 speakers, we will then have the Q&A session, followed by concluding remarks from Helga Fogstad. You, I'm sure, know her. She is Executive Director of the Partnership for Maternal, Newborn, and Child Health. So I really hope that you enjoy this session, and I would immediately turn to Ms. Gabriela Cuevas Barrón, the UHC 2030 Steering Committee co-chair. So Gabriela, you have the floor for the next 5 minutes. The floor is yours.
Thank you. Thank you very much, Maria Fernanda. I am really happy to be here. Hello, everyone. I am Gabriela Cuevas, co-chair of the UHC 2030 Steering Committee and one of the principal group members of the Coalition of Partnerships for UHC and Global Health. Thank you all for joining us for this discussion ahead of the high-level week of the 78th United Nations General Assembly. With the upcoming SDG Summit and the high-level meetings on universal health coverage, pandemic prevention, preparedness and response, and tuberculosis, it is more important than ever that we work together to achieve health for all, and that we are consistent and persistent in our calls to political leaders to commit and to take concrete actions. As you know, progress towards universal health coverage is far off the track from our 2030 SDG target. At least half of the world's population lacks access to essential health services, and each year, more than 500 million people are pushed into extreme poverty due to out-of-pocket health expenses. This is unacceptable. Health is not a privilege. Health is a fundamental human right. It should not be determined by a person's income or country of residence. To ensure that no one is left behind, we must guarantee access to quality health services for everyone, everywhere, and make sure that health costs never lead to poverty. That is the true meaning of universal health coverage. This is how we wield equity. COVID-19 has shown that we already know. Universal health coverage and health security are two intertwined goals. Pandemic prevention, preparedness, and response, as well as combating infectious diseases such as tuberculosis, are done through the same health system. During the high-level week of the General Assembly, we must emphasize the urgent need for synergies across health agendas and the importance of health as both a goal of the SDGs, but also an enabler of many other economic and social outcomes among SDG targets. I mean, if we are not able to provide health for all, then how can we think about housing, about fighting poverty, about eradicating hunger? We will only make progress on all health-related SDG targets if we work collectively to build and strengthen equitable, resilient health systems based on primary healthcare. At the high-level meetings and in the political declaration, we need member states to make actionable commitments to reach all groups in society, including those most at risk of being neglected, and to address the global shortfall of 15 million health workers. They must also ensure women's representation in health and political leadership, and of course, full inclusion of women and girls in all health issues. The high-level meetings are about governments, are about political leadership and political will. And yes, governments are responsible for achieving health for all, but we are responsible for holding our governments accountable. Let's work together to ensure that health remains on the highest political agendas and to hold governments accountable for our common goal. Once again, thank you very much for joining us today. And thank you very much to all the partners that we have at this coalition. If we are together, we are stronger, and this is the moment to place health at the highest political agenda. Thank you so much to all.
We have to thank you, Gabriela, and thank you for reminding us that unfortunately, UHC is off track according to the SDG targets. It's really concerning. Just also for sharing these staggering numbers that 500 million people are pushed into poverty because they have to pay for their own healthcare. And as you reminded us, health is a human right for all. So we really need to scale up our ambition to implement and deliver on the already made commitments, including the UHC high-level political declaration of 2019, and hopefully the one we are going to adopt during the upcoming UHC high-level week in 10 days from now. So thank you very, very much, Gabriela. I immediately turn to Kathy Dane, CEO of NDC Alliance. So you have the floor, Katie, for the next 5 to 7 minutes. The floor is yours.
Thanks very much, Maria, and thanks to UHC 2030 and the Coalition of Partnerships for UHC and Global Health for organising this webinar on keeping the momentum high on health-related high-level meetings just ahead of the UN General Assembly. Just to start, I mean, I think it obviously goes without saying that these 3 health-related high-level meetings on UHC, PPPR, and TB in just over a week's time are obviously a major opportunity for health. NTD Alliance and all other partners have been very actively involved in ensuring that these result in successful outcomes and an opportunity to review concrete progress on UHC and other global health priorities. I think it's also worth pointing out that it's quite unprecedented to have these 3 health-related high-level meetings in quick succession at the UN General Assembly. To my knowledge, it's actually the first time that this has happened. And as negotiations in New York on the 3 declarations are wrapping up, I think it's a good time to really review and assess what has been agreed, obviously, what has worked within the process, and what we need to learn from, as well as what happens next, obviously, to ensure that the words made in New York by our heads of state actually translate into action at the country level for health for all. So I've structured my remarks around those three kind of aspects. And firstly, just to kind of touch upon the fact that there is these three high-level meetings happening in quick succession. I think there have been a lot of positives because of it. Arguably, it's really a reflection of global health growing as a priority within the UN and in New York per se. Also, it's provided opportunities to really build awareness within governments, refocus them, advance the agendas. It's also provided an opportunity to be making the case to governments about how the global health agenda is so interconnected and interlinked, and that action and investment is needed on some cross-cutting issues that feed into UHC, TB, and pandemics, such as health promotion and prevention to ensure healthy, resilient populations, for example, strong health systems, particularly at the primary healthcare level, health workforce, essential medicines and technologies and vaccines available to all, as well as community leadership and participatory health governance. And you can see these kind of cross-cutting points reflected in all three of the declarations to an extent. I think also another point to make is that the three high-level meetings happening together has provided a really welcome impetus for the global health community, which is so often so siloed, to collaborate and coordinate on policy and advocacy, really kind of drawing upon the spirit of the Sustainable Development Goals. However, I did want to point out a couple of kind of drawbacks to having three health high-level meetings all within the same week, which I don't think we should skim over, and I think it is important to kind of learn from. You know, I think it's clearly posed many challenges from a logistics and a bandwidth perspective for member states negotiating the declarations. Many permanent missions in New York are obviously fairly small, and having to cover all three negotiations at the same time has been a real challenge. I think it's been made particularly difficult with the pandemic treaty being negotiated at the same time in Geneva. And the same bandwidth issues have also applied to many civil society organisations. We've all been extremely stretched thin trying to engage in all of these political processes, trying to raise the bar higher in terms of the outcomes, keeping pressure on governments. I think at the end of the day, there is a risk that we essentially dilute the issues, dilute the impact of the three high-level meetings. And I think this should be thought through going forward in terms of future high-level meetings on health. But so what next after the three political declarations are adopted next week? Clearly, we have our work cut out. The high-level meetings are really the kind of the beginning and not the end. This is when the work really begins. We have to roll up our sleeves as advocates to ensure that the commitments made at the UN translate into country and regional level impact for people. And I think overall, what we're aiming for after high-level meetings as a sign of success in a way are three things. Number one, expressions of sustained concern and commitment by political leaders on the issues that we're talking about and committing to. Number two, accelerated action and implementation of the commitments and policies that have been made. And that is a major challenge. We know this from the NCD experience. And number three, adequate and sustained investment and resourcing. So it's not good enough that commitments are made. We need to see the money to be following. So a few kind of concrete suggestions of, you know, what next after these high-level meetings to ensure that it doesn't end up being a cliff edge, as we say. Firstly, continuing to support champion governments that have led and supported these three high-level meetings. We know that champions are key. We need to continue to nurture their leadership. Also, number two, sharing the outcomes at the global, regional and country level. It's upon all of us to be doing that through our different networks, our different constituencies, essentially building the demand for action. Number three, making sure that we're taking these declarations and outcomes to other political forums and political processes. To name a few, different regional political blocs like the African Union, the High-Level Political Forum on Sustainable Development, the G7, the G20. We really need to be making these connections between the different political processes. Number four, I think this is absolutely essential. You know, I think one of our reflections on the UHC declaration is that it is quite vague in terms of the language. It hasn't necessarily moved forward all of the different aspects that we wanted to see. And so what we need to see after this high-level meeting is for governments to be translating these commitments into concrete costed national plans, as well as targets, ideally, and civil society plays a really important role in supporting governments in doing that. And then number 5, it connects to a point I made earlier, maintaining and supporting the coalitions and the partners that have been strengthened or established through these high-level meeting processes. You know, I mentioned the fact that this has been an opportunity in terms of bringing the global health community together, taking us out of our silos and working together on these cross-cutting issues. And I think we absolutely need to continue that going forward as we look towards the 2024 AMR high-level meeting, NCDs in 2025, UHC again in 2027, to be continuing that cross-fertilization and coordination. And then number 6, to be ensuring inclusive health governance mechanisms are in place at national level that really truly engage civil society and affected communities in public health decision making and regular reviews of progress. I think from our side, it's unfortunate that the declaration on UHC hasn't been more stronger on inclusive participatory health governance. It doesn't feel like it's taken that agenda forward. So we absolutely need to be pushing above and beyond the declaration on that. And then finally, I would say focus on the investment and the resourcing. You know, we need governments to be putting their money where their mouth is. It's a constant challenge, competing priorities, new emergencies coming around the corner. In the UHC declaration, member states acknowledge the concerning trend of increased out-of-pocket spending, as well as recommit to increasing spending for primary health care by at least 1% of GDP. But it stops short of really specifying more concrete targets on health spending. And essentially, it's not enough for the problems at hand. So I think we absolutely need to be pushing for bolder targets for health financing, as well as improving efficiencies within existing health financing streams. So I think I'll pause there and pass back to you, Maria. Thank you.
Thank you, Katie, for the recommendations, for reminding us that the declarations themselves are only tools and the beginning of a process that needs to have the impact, the action, the political engagement, and that we basically need costed and sustainable national plans with concrete targets. That's what we would like to see. At the same time that we bring the discussion, the overall health discussions to other spaces, both regional and global, and to keep constantly the momentum, the narrative, and the asks, you know, as a permanent role for our coalitions and platforms, and to continue to support and interact with the champion countries. So we are receiving already a few questions on that front, but thank you very, very much, Katie, and I will turn immediately over to Anjali Akrekar, Deputy Executive Director for the program branch of UNAIDS. So you have the floor. I will get back to you, to the speakers, with the questions we're receiving in the Q&A. So thank you once again, Katie, and for the recommendations and for the analysis as well. So Anjali Akrekar, you have the floor, Anjali.
Great, terrific. Thanks so much, Maria, and really thanks to all of you for your participation in this important webinar that really does come at a critical time before we all enter into the high-level discussions that'll occur next week in New York City. I represent the joint UN program on HIV and AIDS, and this represents 11 different UN agencies with different sectors. And so I come to you bringing perspective from across various sectors as we approach these various high-level meetings. So UHC, health security, and ending the ongoing pandemics of HIV, TB, and malaria are all intersecting goals. And during the high-level meetings on TB, UHC, and pandemic prevention, preparedness, and response that are starting next week, I think it's really important, as was noted previously, that we must be united and show solidarity, really collectively highlighting the dire need for prioritizing health. We must lean in to the opportunity to push collectively out of our silos, as Katie mentioned, for synergies across health agendas and integrated approaches for ensuring health equity and health rights for all. We can't afford pitting one disease program against the other, or health system strengthening efforts against disease-focused programs. And we've learned a lot fighting the HIV pandemic over the past 40 years. And this is one area, the global HIV and AIDS response, where we are indeed making progress. Ending AIDS is an opportunity for a uniquely powerful legacy for today's leaders. Country leaders have the chance to be remembered by future generations as those who ensured the policies, the programs, and investments that put a stop to the world's deadliest pandemic, which, despite incredible progress, still actually does remain quite dangerous, where a life is still affected every single minute. Over 9 million people still miss out on life-saving HIV treatment, including 43% of children living with HIV. And last year alone, another 1.3 million new HIV infections occurred last year. We can't end the AIDS pandemic as a public health threat by 2030 if countries cannot ensure UHC to preventive, diagnostic, treatment, and care services for HIV and other relevant diseases and health issues. And there cannot be health for all if HIV and other pandemics and epidemics are not effectively tackled in a multi-sectoral way across health and non-health sectors. There cannot be health for all either if societal and structural barriers to essential and other critical health services, including stigma and discrimination against some groups of people and communities or in health settings, are being deprived of rights to health access, continue. So sustainable investments in people-centered, resilient, and sustainable systems for all, for health, including community systems, primary healthcare, and integrated systems and services, prioritization of the most vulnerable and marginalized populations, adequate and sustainable financing, technologies and implementation innovations, and protecting healthcare and community workers, community engagement and leadership, and addressing societal barriers, including gender inequality, human rights violations, stigma and discrimination. All of these will help addressing bottlenecks and ensuring health for all and leaving no one behind. These efforts are critical for reaching health equity, social and economic prosperity, well-being, and quality of life. As I said earlier, we are in fact making progress on SDG 3, particularly SDG 3.3, one of the only SDGs that is moving in the right direction. And this is because we're working collectively to build and strengthen equitable, resilient health systems that deliver for all people and communities in need across the life course. And this is particularly relevant as we have approached the HIV response over the past 40 years. We must hold the governments and other stakeholders to account. We must make sure that countries set ambitious, measurable, and time-tangible, people-centered targets. Another lesson learned from the global AIDS response shows that without active participatory engagement of affected populations and local communities, civil society, and non-health sectors in decision-making, setting clear strategies, and actual delivery of services, along with the leading role of the health sector, will not see the progress towards universal health as we hope to see. So this September, the 3 UNGA high-level meetings on health and the SDG Summit provide us with an opportunity to reflect on the progress made and gaps in following the global health commitments adopted by the previous UNGAs since 2015, to strengthen collective accountability and commit to truly transformative changes as we approach 2030. We encourage all of you to use the UHC Action Agenda and amplify its recommendations for member states to intensify their efforts for health for their citizens and make comprehensive commitments and plans for health in the SDG Summit and each of the health-focused HLM's political declarations. Again, thank you so much for being a part of this session today, and we look forward to seeing and working with many of you in the week to come, as well as beyond. UNAIDS will definitely be there, active and loud. Thanks so much.
We have to thank you, Angeli, for a great intervention. Your call that we have to work united, work on the One Health principle, and go beyond illness-specific agendas, the need for cross-sectoral responses, the need to craft strong, resilient, and well-funded health systems, starting with primary health care. I think it's extremely important, and to look at from a holistic view, looking at gender equality, human rights violations, to use the UHC action agenda as a tool for everything we do, from advocacy to direct action on the ground. And you mentioned make governments accountable, and we already saw a comment from one of the participants calling for accountability as well. So participatory engagement in health decision-making is also a very important and strong call. We need, social ownership of health policy and practice, and citizens, local communities have a very, very important role to play, and of course, including women. So thank you very, very much for that, Angeli. And I will immediately turn to Dr. Suvanand Sahu, Deputy Executive Director of the Stop TB Partnership. So Dr. Sahu, you have the floor.
Thank you, Maria, and thank you, UHC 2030, for giving us this opportunity to share on a common platform. I will talk briefly about the perspective of tuberculosis and Stop TB Partnership. As you may know, as others have said about other SDG targets, the progress on TB is off track, and it got pushed further off track because of the COVID pandemic. And as countries are currently recovering quite at a good pace, now the ambition is to move faster, learning from the experience of COVID, and to be able to be on track to reach the targets that have been set for ending TB by 2030. Now, in that context, this meeting, the UN high-level meeting, is very critical, very timely. We from the TB community have engaged quite a bit throughout the process. I would highlight a few things here. Now there is a political declaration on the website with the letter from the PGA. All three high-level meetings have a political declaration. We hope that it will be finally approved, because we saw two times in TB silence process being broken. And we were also very surprised that most of the objections were related to language that has not so much relevance to TB, but on language that and phrases and words that the world doesn't agree. Very different perspectives exist between countries. So we hope that this political declaration that is on the website is endorsed finally. We know that it is having some strong commitments, for example, on numbers of people to be treated for tuberculosis, the funding that needs to be made available. But we also know that because of the diversity of countries and their views and opinion, certain things that we wanted could not be reflected in the political declaration either clearly, or they were weakened due to the consensus process. So it is what it is, and we have to live with it. But it is a document that will help in advocacy and what efforts are needed jointly as a global community. Now, a word here about the link between UHC, TB, and pandemic preparedness. Right from the beginning, we from Stop TB Partnership gathered the TB community together in a common set of asks for TB. There was very specific language for UHC and TB, also on pandemic preparedness on TB. We also see that in the final declarations, we didn't achieve everything that we wanted, but there are some references to it. Particularly, I must point out that in the TB declaration, UHC is there, even something that states to the effect that we need UHC to end TB. I also wanted to point out, because beyond the political declaration, when people speak in the 3 UNHLMs, maybe the same people will speak, the health ministers in all 3 of them, or their heads of government. We also wanted to remind people from the TB community that TB needs to come in their reflection on UHC and PPR. For example, currently, if you look at people with tuberculosis, and we all know that tuberculosis disproportionately affects those who are poor and those who are vulnerable. Now, 3 to 4 million people worldwide, 3 to 4 million people worldwide every year are not able to access tuberculosis diagnosis and treatment. This is a disease that has a cure. This cannot happen and with UHC, right? So what we are saying is tuberculosis can be a good marker of progress for high TB burden countries, where you can see how many people are missing from care in tuberculosis, and that will be a marker of progress for UHC. Let me point out one other thing about the link between tuberculosis and UHC and how we are framing these two. Out-of-pocket expenses are huge in countries. In tuberculosis, we know, and WHO has put out the figures there, almost half of the people with TB who access care actually incur catastrophic costs. And this should not be happening. If UHC is there, this should not be happening. So what we are saying is take TB as a marker of progress, at least in the high TB burden countries. Now, let me quickly shift to the things that will happen next week. Stop TB Partnership will be there. We have a website where we have put together the side events, not only where Stop TB is leading, but other TB partners are leading. A lot of important activities are happening right throughout the week, because we felt that the high-level people may not be there till the end of the week when the health UNHLMs are coming up. And unfortunately, TB is the last day on the Friday. So we are planning a number of meetings earlier on in the week. And you are happy to, we will be happy if you want to contact us for further details. It's available on our website. I wanted to also say something about the participation there. We have encouraged that countries should come not only with the governments, but in their official delegations should include civil society. We heard good news that at least a few, still it is single-digit number of countries, they have included. And we are very happy about that. But let's see how many of them are coming to New York with officially civil society participation and demonstrate the inclusivity in the delegation from the country. We are also aware that a few heads of state will be there, but not many. At least they may not stay till the end of the week when we have the TB meeting, but we have some events where we have invited some of the heads of states and the higher levels. I wanted to also bring to our attention another thing, which I think somebody else also spoke about. The real action now is at the country level, because all these commitments have to be translated into country level commitments. We have some global level commitments in TB, which has to be now disaggregated to the country levels. We are working on it, and hopefully we will achieve those broken down targets for each country, more concrete, and to be able to help the country in articulating some plans to achieve them, but also to allow the civil society partners to hold them accountable. So the real action now shifts after next week to the country level. And I think that will be a great opportunity for all of us to work and also further advocacy at country level on how to go ahead with these commitments and how to use it. At the global level, as people have pointed out, a lot of opportunities coming up. The heads of G20 met. There is something on TB, not much. How can we make it stronger with Brazil presidency? How can we make the G7 next year stronger? So I think we as global community need to also work on this kind of opportunities. Also the regional ones, as Africa Union and ASEAN, they meet and discuss. Health should remain as the priority. So I would stop there. Thank you for the opportunity.
Thank you very much, Dr. Sahu, and for your words of wisdom and the urgent need, you know, to harmonize the three declaration, the strong linkages between TB and universal health coverage. You are so right. When we speak generically on things, you know, usually there is agreement, but when you go further to speak about concrete targets and concrete funding and investment needed, then the situation starts to become complicated in negotiations, and unfortunately that does not only happen on the health discussions, but in every single discussion in the multilateral scene. You know, I was shocked when you mentioned the 3 to 4 million people every year that cannot access to TB diagnosis and treatment. This cannot be, and this is something that a strong universal health coverage ecosystem should be able to deliver for. And also thank you for insisting from your end to have civil society representatives in national delegations for the Friday high-level meeting on TB. And you're also right to say that global declarations do help. They are policy guidance for countries, and it really is a guidance, but where real action happens is at the country level, and that's where we should put our eyes and the accountability mechanisms in place. So thank you very much again, Dr. Sahu. I would now turn to some of the questions we have received so far through the Q&A. I am asking all the participants, feel free to pose your questions using the Q&A mechanism. But let me now turn to the speakers again with the questions we have received so far. The first question is, which countries have championed the UHC efforts and this high-level meeting? This question can be addressed to Katie or to any other of speakers, also to our co-chair herself, Gabriela, because she's been in close contact with several government and member states on this that are pushing the agenda on UHC. And the group of friends, especially on UHC, have been extremely active and supportive of this process. So I turn back to you for any reactions. But I think that Katie mentioned the countries that are supporting the agenda, and perhaps I'll turn to you for this question.
Thanks a lot. So, I mean, I was referring to obviously the kind of co-facilitators of the process, Thailand and Guyana. And as you were referring to there, Maria, I was also thinking of the group of friends of UHC at the UN as the kind of obvious kind of champion group, which includes Ghana, Sweden, Rwanda, Georgia, Kenya, and I'm sure many others. But yeah, my point is that, you know, obviously these governments have really been kind of at the forefront. They've been leading the process. They're clear champions, and as well as obviously trying to bring other governments that haven't done enough on UHC, we really need to be kind of nurturing that leadership on UHC going forward.
Well, thank you, Katie. I don't know if you know, someone would like to add to what Katie mentioned just now, but it's true. And Georgia, you know, and the group of friends of UHC is growing, and we're growing. So I think it's extremely encouraging, and they have been really, really helpful and strongly committed to the previous UHC high-level meeting, and I'm a witness of that, but also to this, to the current HLM and to the declaration. So it's very, very important to keep them on board, to keep them connected to the movement as we have done so far. So if no one else wants to respond to this question, we have
Yeah,
please,
yeah.
Dr. Sahu, go ahead.
Just quickly to add here, the TB UNHLM co-facilitators were Uzbekistan and Poland. I think they did a good job in getting all the consensus and all that. So that was good. There was a very interesting dynamic, which I wanted to flag for all of us to reflect. The group of 77 called G77, which actually currently has 134 members. For the TB political declaration, they decided to negotiate jointly. As a result, we had Cuba in the lead, who's now the lead for the G77 for the negotiations. Cuba, one country, was representing 134 countries, and all of our high TB burden, almost all of our high TB burden countries are in that block. So what we felt was that was one voice versus several other voices in the room from other countries. So that probably was not the best way to do it, but that's international diplomacy, and I don't know what was the experience with other health, other UNHLMs.
Thank you, Dr. Sahu. But indeed, and usually in the intergovernmental negotiations, regional groups and major groupings are represented, not only in the health sector, but in all areas of negotiation. The G77, obviously, is the biggest group of developing countries and developing economies, and there is a chair every year, and the chairmanship, of course, represent the voice of the 134. So this is a common practice. I know it's a little difficult, but sometimes it does help to have one voice. I would read the next question. It's open to any of the panelists, and the question says, based on the current political declaration of the three health-related high-level meetings, would you assess that they were well synergized? That's an excellent question. Are there any further actions or commitments needed by countries? What are the roles of different stakeholders? That's a long question, but the key question to you all, the panelists, if there are synergies between the three political declarations as they stand. Someone would like to answer that question?
Maybe I can go, and maybe others
please,
can.
Please give it a try, Dr. Sahu.
Yes. So actually, at the start of all this process, we and I personally had a higher ambition that the synergies would be great, and a lot of things would be discussed between the groups, and between the processes there will be some opportunity to collaboration. But there was some progress. I'm not saying that there wasn't any. There was some progress. This group is a good example of that. But I must say that the ambition we had and what happened was quite different. And I think we have the potential to do better, and we should do better next time. Thank you.
Yeah, indeed. It was a challenge, and I think Katie mentioned the positives and the negatives to have the three high-level meetings happening during the same week. Among the positives was the opportunity to have a genuine dialogue between NDCs, pandemics, and UHC. And unfortunately, because of the way the negotiations are set up, it's very difficult to have this point of encounter. And I think Katie also mentioned, the challenge for small delegations, They have to multiply themselves. They don't have often the resources in place, etc., and they have to prioritize. It's a huge challenge, but and yet again, just listening to you, it really shows how these three are interconnected. So Angeli, insisted on this One Health, a holistic approach to responses and action and investment. You mentioned, Dr. Sahu, over and over again, the connections between UHC and TB, how they have to, they need to be closely connected, but at least the acknowledgement of the importance of UHC and of primary healthcare together, I think it's the umbrella, literally the umbrella under which, all these illness-specific efforts should be deployed. And of course, the pandemics discussion. And of course, let's see how the high-level meeting on pandemics is going to speed and accelerate the pandemics treaty process that is going extremely slow. So thank you also for that question. There is another question it's addressed to Dr. Sahu, but you're very welcome to comment as well. This would be, unfortunately, our last question, because I want to give time to Helga Fogstad to make some closing remarks. So the question is how the community level of essential public health functions in primary healthcare in low and middle income countries collaborate in providing surveillance system and diagnosis for TB through task shifting to third-party logistics. That's a very technical question. Dr. Sahu, you can respond to that one, but it's of course open to all of you.
Yes, so in TB, there has been a lot of efforts to decentralize service delivery to the level that it can be done at the community level and primary healthcare level. There has been a lot of involvement of the communities in the service delivery, but also creating the demand and to breaking the barriers, for example, stigma and rights and gender issues. But also what has helped is the technology part of it has helped today, because today you can do a X-ray for the lung, which is a good screening tool for TB, no longer in a high-level hospital, but it is a portable X-ray, which you can do at a primary healthcare level, or even some countries are doing it in a community level. We have rapid molecular tests, battery operated, that can be taken around in a mobile clinic. So we are now actually pushing on delivery of care and prevention services as much as possible at the community level, at the primary healthcare level, and also encouraging not only community engagement, but community-led action. So I think is the future. How can community lead in this area of not only service delivery, but monitoring of services and providing feedback to improve the services? I think this is an area where a lot of work we see in the future. Thank you.
Thank you, Dr. Sahu. We have a few more questions, and I would ask the UHC 2030 Secretariat to help us, respond to these questions, because unfortunately, I think that we are running out of time, or do we have space and time for one more question?
I would return the question back to speakers. If you would like to commit another 5 minutes, the platform will allow us to do so. So
just really one last question with a quick response on the community level of essential public health functions in primary healthcare. No, this was the same one. Yeah, I think the question relates to the high numbers of TB patients in jails in Bangladesh. Is a very, very specific question. Am I right? It's a very do we know something about that? Yes. TB very high in Bangladesh jails, recent rise to cardiac cause, etc., etc. So any special authority in place? That's a very, very specific question. And I promise to the person asking these questions that we will do some research and get back to you. The person who is asking the question is also requesting to bring this to the UN. So, well, with that said, I only have to thank the speakers. It was really, you know, a very substance-driven discussion. I think that we have high expectations for the 3 high-level meetings in New York. I'm sure you are all going to be there, you know, advocating, informing, activating, and I really, really hope that we will come back home with the 3 strong high-level political declarations that are going to really, really be translated into concrete action, concrete policy, and concrete investment at the national level. So thank you. Thank you for this. I will see you hopefully in New York next week. And just the cherry of the cake, as we say, we are going to listen from the great Helga Fogstad for some concluding remarks. You have the floor, Helga. The last word.
Thank you, Maria. You have a honey tongue. Thank you for that. So, dear participants and dear colleagues, thank you for this rich information shared and good questions. It is just a week before the high-level meeting in New York, and we all would like to come out of these meetings with reaffirmed commitments and clear ideas on how to better and achieve better results. So, although as many have expressed, it is a great opportunity to have 3 high-level health-related meetings, it is also reflective of that we are in trouble in reaching the SDGs, and that's why we cannot continue as business as usual, especially after COVID, in the midst of climate change, conflict, and also economic crisis. So the numbers of women and adolescents and children dying from preventable causes are too high and unacceptable. So given all this, it is critical to strengthen health systems to be able to deliver on UHC for all, including being prepared for any pandemic, and focus on high priorities, like, for example, ending TB. So, however, it is critical that the most vulnerable are prioritized and protected, and that this is made explicit in all development plans. So equity is key. So as was highlighted during this discussion, there is no other cost-effective way to do this than a collaborative and addressing critical cross-cutting issues together, such as ensuring quality and adequate health workforce, access to life-saving commodities, and more efficient financing. The Coalition for Global Health and UHC, and as clearly said by many during this discussion, we urge everyone to maximize synergies and look for new ways to ensure health systems are resilient and equitable. We do so through a primary healthcare approach, maximizing community engagement, and also cross-sectoral collaboration. So we must make it our business to ensure that millions of people, young and old, especially women, children, adolescents, can access the quality and affordable health services they need, including sexual and reproductive health and rights. Finally, I would like to echo your calls for countries and political leaders to prioritize equity and to implement their commitments with urgency. Vis-a-vis the previous resolutions, there is a global shortfall of 523 million people in achieving the commitments made in the political declaration of 2019 to progressively provide 1 billion additional people by 2023. with quality essential health services, quality, safe, effective, affordable, and essential medicines, vaccines, diagnostic, and health technologies. We cannot afford not to deliver on commitments made. But no one can do it alone. We have all a role to play to end TB, to be better prepared and respond to emergency threats, and build systems that ensure that everybody, everywhere, can be healthy and live a fulfilled life. Healthcare is expensive, especially if it is an afterthought. In fact, health should not be seen as an expense, but as an investment and right. As such, it is our collective responsibility to make health services as efficient and effective as possible. So, resolutions and high-level meetings are important, as has been said, but as it has been also said today, the resolutions are only as good as if they get implemented. As such, it is our jobs as advocates to ensure their implementation. We need concrete, measurable, and costed plans with inclusive multi-stakeholder participation and adequate financing commitment. In order to do this, we need to make sure to take a cross-sectoral approach and penetrate multiple political fora, including regional and sub-regional platforms. It is on our watch. We must deliver, so please join us in a collective effort. Thank you.
Thank you, Helga. These are very, very strong and clear calls and last words. Healthcare is an investment, a human right, and what we need after New York is action, implementation, measurable goals and targets, and we need more than ever collective wisdom and collective action, and we have a role to play there. So thank you very much for this. It's been an incredible panel and an excellent preparation for next week in New York. So thank you all for being with us today.
Thank you, everyone. Have a great rest of your day, and thank you to all participants who joined us today. 60 or so of them. Have a great rest of your day.
Thank you.
Bye.
Bye.
Thanks. Bye.